Deadlifts is not for everyone. How important warm up?
The negative side is you can't get right into the area.
Okay.
A bit deeper.
Right.
So
I'm gonna can I repeat my same workout again, or do I have to wait till I'm completely recovered?
especially once you pass 30, there's a decline in terms of maintaining muscle mass. A lot of people call themselves physiotherapists or use the term physiotherapy. You need to do your research behind that.
Welcome back to another interesting podcast with Fitness Island. We got a very interesting guest who brings a very different expertise to the table. Welcome, Physio Roch. Welcome to the show.
Thanks for having me, Machang. Really appreciate it.
Right. I'm gonna straight dive into the questions. There's a lot of things. As a fitness platform, a lot of our questions come from people about a lot of pains, a lot of aches. So this podcast is for you if you're someone facing different kind of pains, aches, stiffness, and we're gonna talk about things like mobility. A lot for you to learn, especially if you're someone who lifts heavy weights. And I'm sure there's a lot Sean will like to share. Sean, let's get this conversation started. I want to ask you, what are some of the common things you see? Like I know a lot of guys who go to the gym come to you.
Yeah.
I personally have friends who come to you. What are some of these issues you've seen from guys who are coming from a fitness background?
So very common injuries that I normally tend to see, bro, is like I was mentioning earlier, like a couple of things that where people tend to make a lot of mistakes in terms of lifting techniques.
Yeah.
Is especially when they do complex lifts like compound lifts like deadlifts and squats.
Okay.
So what tends to happen normally is most of them they get the mechanics wrong because they haven't done their rather prehab exercises, like
Okay.
the basic exercises to strengthen the rectus spinae muscles, as I mentioned earlier.
Yeah.
So once we do that, because technically, according to a certain philosophy, like I was saying, it's called Gonstead approach in terms of it's a chiropractic approach.
Okay.
But what they tend to say is, bro, you need to have 60-degree reciprocating curves.
Okay.
6 degrees convex in the cervical, 6 degrees concave in the thoracic, and again 6 degrees convex. It doesn't mean it has to be 100%.
Okay.
But that
Lot technical, but I understand. Yeah.
Sorry.
Yeah, that's fine.
But essentially, so bottom line is you're not supposed to ideally be doing lifts like that, especially if you have a flat lumbar spine.
Okay.
It's straight.
So are you saying deadlifts is not for everyone?
Not to start off with.
Okay. Okay.
So it's all about re-educating muscles that are weak.
Right.
Do the certain movement pattern.
Right.
It's like me telling you to go and lift, crazy load straight away when your body is not ready to handle that load. It's not about you not being able to do it. Not right now. It's
Understand.
time, no, bro.
Understand.
First you crawl, then you walk.
Yeah.
That's how it works. That's motor patterns the body functions on in general.
Okay. So what you're essentially saying is everything has a time. So what we commonly see in the fitness arena is like when someone starts, their trainers or even friends try to push to lift much heavier weights.
Yeah.
And that is how most of these are kind of the root cause for most of these problems, right?
Exactly.
Okay. Now moving on, I really wanted to ask you on this is how important warm up is, right? Because there's in the fitness field, we talk about static stretching and dynamic stretching.
Yeah.
Can you elaborate as a warm up, which is preferred and why? Should people go for static stretches or dynamic, and if so, why?
If you are in a nutshell, dynamic is only what's in right now, because that's what you're supposed to do before your routines, and then afterwards, if you to prevent. So wait, let's just stick to one thing.
Yeah,
so,
let's go with the warm up first.
With the warm up, okay. So dynamics, the reason why dynamics came in, dynamic warm-ups like mobility work and all that stuff prior to you were actually doing the lifts, what they say is essentially if you do static stretching, the nerve conduction velocity to the targeted muscle fibers gets slowed down.
Okay.
So when you go and do a certain activity, now say for example, you do static stretching for say hamstrings.
Yeah.
What happens, bro, is it's not going to fire effectively. So when you go to do stuff like, say, squats, especially squats, not like leg curls are fairly safe, isolation exercise, you're not going to do anything. What happens is the muscles is not going to activate properly.
Okay.
So when you're, say, if you're lower down, the squat, and you're trying to push off at that particular point, that's where shit starts to, your foundation's not going to be stable, so it'll collapse.
Okay.
So that is why you don't do stuff like static stretching before. Ideally, dynamic stretching is better because it doesn't hamper that
Okay.
that neurotransmission.
As a physio, you're recommending our audience that they need to switch to dynamic stretching if
Yes,
they are doing static
before
stretching.
workouts,
Right.
yeah.
Now, on that, what's an ideal dynamic routine like for a lower body workout?
So stuff like so a lot of thoracic mobility where you're twisting from the
Mic.
oh sorry, a lot of thoracic
Sorry,
mobility.
I gotta remind you to come closer to
Sorry.
the mic. Yeah.
Sorry. So yeah, a lot of thoracic mobility. We need to incorporate that. So where
Okay.
you rotate and do all those movements to the thoracic spine. Stuff like they call it plays, I think, top plays. So where you swing your leg outside and
Okay,
inside,
yeah.
those type of movements.
Movement.
Basically, don't hold the stretch for long.
Okay.
Whatever you do, even if you're doing quick, you just stretch and you release. Don't hold
Okay.
it for more than 10 seconds.
Right.
It's quick stretch.
So another common thing I've seen in the industry now is for warm-ups, people do lighter loads of the exercise they are performing on the
That's also
heavier
fine.
and just for higher reps.
That's
Is
also
that
fine.
something, for example, if you're doing squats, someone as a warm-up, instead of doing any kind of dynamic or stretching, what they'll do is do on the bar for like 20-30 reps to get the movement right. Is that acceptable, or are there any specific stretching you need to do?
That's from personal experience, that's acceptable. But if you're in countries like where it's fairly cold and chilly,
Yeah.
you need to do the other stuff as well, bro.
Okay.
So that's where you get injured. In Sri Lanka, you can get away with it.
Right. And for an upper body warm-up,
It's fairly-
dynamic upper body warm-up,
Yeah.
what are some of the stuff you'd recommend?
I don't know the names of the exercises.
Okay.
To be very frank with you, I just know the movement.
Yeah.
That's it. Like you need to work on a lot of thoracic mobility, those type of
Okay.
drills. Then there's one called the world's greatest stretch where you lean forward and you.
Okay.
It's common yoga movement that they use.
Okay.
Which is really good. It ties in all structures in one go. Those kind of stuff. There's no specific thing. It's
Got
just
it.
that don't hold the stretch.
Don't hold the stretch.
Just get into it and move out. That's good.
Okay. And moving forward to the warm down. No, that's
Okay.
we spoke about warm up. Warm down. This is where static stretches come. Is it? And if so, why? I just want to understand the science behind this.
So this is the scene. Why we normally tend to? It's not that it's a must.
Yeah.
It's good though. It's
Okay.
better to do the static stretching after your routines
Mm-hmm.
because what happens is when you're working out, there's a thing called trigger points that develop in the body.
Okay.
So they call them knots.
Yeah. Muscle
Knots
knots.
is a very elaborate term. It could be adhesions, it could be scar tissue, it could be anything.
Okay.
But essentially, these trigger points also fall in that knot category.
Mm-hmm.
So those, what happens, bro, is when you overtrain the muscle shortens. No?
Okay.
So these trigger points tend to develop.
Okay.
Now, what happens is to deactivate them, to kind of get them to release and to get the optimal length in terms of the muscle. Static stretching is good.
Okay.
Because it perfuses the muscle tissue with blood. And
Okay.
it clears up the ischemia, lack
Okay.
of circulation in the area. So essentially what it does is it prevents you from wanting to, constantly go and it prevents you from getting injured later on. Not really injured, that's the wrong word I use, but rather having discomfort.
Okay.
So acute muscle, this what we call a DOMS, delayed onset
Okay.
muscle
Delayed
soreness.
So what you're saying is static stretching can kind of make you not feel the DOMS or delayed onset muscles?
Yes.
Okay.
Yeah.
Does things like cycling also help? Because one thing I've also heard is people saying, if you feel like you're going to feel so the next day, you should go and do some cycling or some treadmill walking. Does that really help?
Yeah, that also helps because ultimately it has to be low intensity.
Okay.
And essentially it should be the point where it's basically pushing out whatever again people say lactic acid, it's really lactic acid. I would say lactic acid is not really what causes the pain.
Okay.
It causes stiffness of the tissues.
Right.
So in that case, yes, you want to get that out. But there are other components, other bioinflammatory mediators that are released when you work out, when you damage the muscle tissue.
Okay.
There are quite a few. There's bradykinin. There's histamines, various things that are released that stimulate the pain receptors. That's what causes you to feel sore the following day.
Right.
But serotonin. Sorry. Anyway, moving on. Sorry.
Yeah.
The point is, the idea is we want to minimize that.
Okay.
That circulation
Understood.
in the bloodstream.
Understood.
In that particular area, the vicinity of the muscle.
And if I'm to ask you, now I spoke to you off camera also because I was out of curiosity. Where does the foam roller come into play? Now,
Okay.
I've heard two sides saying foam rollers don't really do much, right? I'll connect the question.
Yes.
Foam rollers, massage guns. Now these are
Yeah.
like the
Yes.
popular ones among the fitness. Everyone wants to have
Very
the gun after that. Are these really helpful? And if so, how? And should people invest on these things?
Okay, so same thing what I just mentioned, bro. Like we can also tie that in from our previous thing, but you just mentioned, which is a perfect segue. It's all falls into the category of recovery.
Okay.
So when I say that, I mean ultimately, like say now when you train, obviously you're going to push it at some point. You always want to challenge
Yeah.
yourself. That's what
That's
what
what-
it's all about,
yeah.
right? Ultimately, train hard to go home.
Go
Simple
home.
as.
Yes.
So what essentially happens is when you do these things, muscles are ultimately going to shorten. No matter how much of prep work you do in terms of stretching and all that stuff, you can't get into the localized area as easy as
Okay.
without using these interventions.
Okay.
So a massage gun is good, but the negative side about the massage gun is the frequency normally tends to get, whichever frequency you use, you can't still get right into the muscle belly where you actually have the trigger points, the majority of the trigger points.
So massage gun can't really get to that point.
It's still good.
Okay.
Massage guns, I use them. They're
Right.
good. I'm not trying to shit
Yeah.
on anything.
Okay.
Sorry.
That's fine. You can swear here.
That's awesome. Okay.
Yeah.
But essentially, we just basically want to release the fascia so that more blood can enter that area and clear up those trigger points, at least on a superficial level.
Okay. So massage guns are something
Decent.
that works on that.
It's-
Okay.
That's good. That the negative side is you can't get right into the area.
Okay.
It's more in the superficial area. Now when you're talking about foam rolling, a little bit more, you could go a bit more deeper,
Okay.
and it's a bit more what do you call it, localized, as in a bit more you can get to the
To
specific
the point.
area.
Okay.
However, there's nothing wrong per se. At the end of the day, what we are trying to do is minimize the need to go and get additional recovery. Now, whether it's sports massages, whatever. It's all about maintaining that optimal length. Like I was saying, your muscle fibers have these things called sarcomeres. So I'm just going to basically what the sarcomeres do is where you get the actin myosin component.
Okay.
They both attach and they elicit contraction.
Okay.
So what they say, champ, is they need to be between 2 to 2.4 micrometers in terms of sarcomere length.
Okay.
So if it's excessively short, that's how you get all these, like where the muscle is extremely compressed.
Okay.
So when it's shortened, what happens is where the muscle, for example, let's take the bicep. So the bicep origin is an area called the supraglenoid tubercle. It's at the shoulder blade. It comes and inserts at an area called the radial notch. In the radius. So what essentially happens now, say if you just take the bicep alone, if it shortens with constant training without doing the recovery work.
Yeah.
Recovery work, what happens is it keeps shortening. It starts to strain the origin point and the insertion point. That's how you develop pain throughout that area.
Got it.
Some people think it's radiating pain. It's not. It's just what we call trigger point related pain.
Yeah. I mean, in a conclusion, you'd say these are actually not useless stuff,
Yes,
but these are
definitely not, bro.
But again, doesn't do the job 100% either.
Only thing is, my only issue with massage guns is you get people who are not trained professionals who, for example, say if they have an acute injury, not soreness, an acute injury, they actually develop a hamstring strain or a tear while they're at the wherever they are working out.
And
what
they try to
people go and put the
gun it. Okay.
You're like stretching, they're displacing the tear further.
People not knowing the difference between a soreness and an injury.
That's why I said, people think we're always trying to get people in. Yes, I understand Sri Lanka has a fair share of people who are just getting people to come and, trying to make it a business. But why I say you need to go and see a professional is because we have studied the game a bit deeper.
Right.
So,
I'm gonna pause you on that because I have a very important question. I feel like so a lot of people, when they're doing a certain exercise, when they first feel that point of pain, they don't know to differentiate if it's something, or should I stop immediately, go see a physio, or should I just continue through my pain, I'll be okay. And I think personally, I was sometimes, like if you feel a sense of discomfort, should you immediately stop and take the next? How do you kind of find the fine line between that?
it's a good question. it's very difficult also for me to answer because each person has a different pain threshold.
Okay.
And there are multiple factors that kind of aggravate the pain response because essentially pain is output from the brain.
Okay.
And what I would suggest is, bro, like typically when you're working out, I mean, now, okay. I mean, okay, if it's a bodybuilder, that's their bread and butter.
Yeah.
They have to be in the gym. They have to train through the pain. They have to develop a mindset rather to train through the pain. However, now if you take an average person, a person who's just starting to work out, who starts to develop pain, it's like this. If the pain is there because of the fact that, and it depends on your type of workout. Now, if you're someone who's doing just heavy lifts, like say, you're lifting, say, 60 to 70% of your one rep max, and you're doing, say, 5 to 8 repetitions. So you're lifting fairly heavy. Oh, let's say actually 70 to 80%. Sorry, my mistake. What essentially happens there, bro, then you're using your ATP CP system. Okay. So creatine phosphate and adenosine triphosphate. So it relies on it changes it to ADP, adenosine diphosphate, and the phosphate molecule borrows it from the creatine stores, creatine phosphate stores from the muscle, which you have to load with various supplements that I endorse. But essentially, what happens is now if you're someone who's training with that sort of a regime and you would tend to get burnt out at the end because you're lifting fairly heavy loads and your body's not used to handle just on a general this thing. But if you're just saying doing light reps and you're just doing constant movements where it's suddenly towards the end you're just feeling a strain at the elbow or on your back. Then, bro, it's something where I would suggest is the pain. What I would say is the pain sharp?
Okay, so that's the question you need to ask yourself. Is my pain sharp pain?
Sharp pain. Okay. It can be localized. It could be radiating. But is it sharp? If it's a sharp or if it's a shooting pain, you're feeling radiating symptoms down the leg. Those are things you need to. Okay, if it's radiating below, stop and walk back a bit and just relax a bit. Then, and if it's fine, you don't have any injury, you don't feel pain, fine. Okay. Again, go back, check again. Right. It might be something wrong with your movement patterns, where you're compensating it on one side when you're squatting, or either whatever movement you're doing. Typically, it's only with the compound movements, never with the isolation exercises. But then I would say back off a bit. Okay. Go see a professional, because at the end of the day, it's all about longevity.
True. That's the end goal.
It's not about health. It's health.
That's the longevity is our end goal.
So I would say back off a bit. But if it's just a general, feeling like fatigued or you're out of breath and all that stuff, then, and your muscles just like the entire.
You need to identify the type of pain. So ask that question, is it a sharp pain? Right. On that, I have another sub question, since we were talking a little specific on exercise. As a physio, now some of these exercise we are asked to not lock out the movement, right? Let's take an example of a leg press. As a physio, like a lot of people, when they go super heavy, they kind of lock out your knee. So imagine this is your knee and you lock it up, right? And we can even take that as an example for a pressing movement, like a shoulder press. Lock it at the top and put a lot of stress on your elbow. Correct. Are these advisable, or should people not lock your joints at any pressing or any movement?
I would say, again, depends on the amount of the rep range.
Okay.
So obviously at some point you're going to fatigue while you're doing your exercises. So you at certain point you'll fail and you need to hold that particular position for a while. If you want, you can drop it down, whatever floats your boat. It's a matter of not repeating that multiple number of times within that particular given set.
Okay. So you can do it maybe like once, you're saying it's okay, but not lock out constantly.
Because what happens is you have ligaments, bro. Those they take the bulk of the load. It's in full extension, complete extension.
And subsequently, I have another in that same scenario. When you take a lot of exercise that have very high intensity, people kind of tend to lose the pattern of the exercise. Let's take a good example would be a burpee. Now, if you do 2 burpees, your quality of your burpee is much higher. Your landing, how you land on your arms, your joints are okay now. But if you're doing 20, 30, 40, 100 at a stretch.
Yeah.
We see people like land on all, like they're
Yeah.
when they're going to the ground, they are, toes are elbows are caving in. What's your take on that?
I'm all about changing the intensity every time. So now, say for example, that's what like a lot of high-end athletes tend to do. They don't work at the same intensity every time. So for example, now the only the sport I can say like in the sense that I've actually been in and now I'm out, retired now, old man. This was MMA. So now MMA, when you're training body, normally what they tend to do is they so now say the morning they'll do a heavy cardio session. When I say cardio, sparring, all that stuff, stuff. But in the night they'll do something that's a lot more lighter.
Okay.
They're not constantly taxing the same energy systems.
Okay.
So next, say for the first workout, you'll do anaerobic.
Yeah.
The second would be the ATP CP system.
Okay.
They'll alterate. So now for example, another set of workouts you'll tap in. You'll use more plyometric where you're explosive, and then another workout you'll use more isometric where you're just holding position.
Right.
That way you protect the integrity of the soft tissues.
Okay.
You're
talking about not taxing the muscle, but the energy system itself. You're kind of changing it time to time.
That as well, and also your muscles anyway. Okay. It's in different ways.
Okay. How you tax your muscles in different...
Yeah.
Understood.
So different angles, different ways, getting it stronger in certain different positions.
Okay.
As my dear friend Andy from CrossFit said, getting stronger in certain positions, moving in and out of positions effectively.
Okay.
He said it beautifully, so I just use that.
Perfect.
So that's what it's about. It's not about doing the same sort of rep range every single time.
Okay.
Because you need to overtraining.
Understood. Overtraining.
Yes.
As a physio, do you think it exists? And what are symptoms of overtraining? How do people know, okay, I'm overtraining, I need to take a break? What are some of the things how do people kind of listen to your body, and what's your advice along those lines?
So now, this is the thing. So now, for example, if there's this thing called cortisol that breaks down muscle. So they say typically after 45 minutes when you're doing any workout, they say normally it's debatable. Some people say 45 minutes.
Yeah.
But what happens is after that time frame when you're working out, that's where it starts to. That's why they say try not to keep a workout more than an hour long. So essentially, what happens, bro, is there's a study where they said again, sample sizes I'm not too sure, so it's hard to say if it's a proper study. Yep. But essentially, what they say is if you're a person who's, say for example, again, Muay Thai fighters, now they tend to train crazy amount of hours a day. Why that is some of them are fairly well built, and like you can see they don't look like they're like malnourished or anything if they eat normally and whatnot. But what happens is the theory behind that is they say that if you keep training say at that particular frequency for X amount of days, say for months, weeks, years, your body will slowly start producing less and less cortisol for that particular given time. It's because your body will adapt.
Yeah.
So, but essentially when you're starting off, bro, if you're looking for those gains, young, we were all young at one point. So, if you're looking for those gains, that wouldn't be a helpful thing. I would say cut your workout down, keep your workout down to 45 minutes.
Okay.
To an hour, nothing more.
Right.
And
another common question would be, Roche, like people ask, so I train, let's say my chest and biceps or whatever today, and I'm sore.
Yeah.
Can I repeat my same workout again, or do I have to wait till I'm completely recovered? And how do we know we are completely recovered to do that same muscle group again?
So that's also a very good question.
Is it okay to train through DOMs to make it a little easier? Like if you have delayed on, like your muscles are sore, let's say you've done legs on Monday and by Thursday you want to do legs again. But it's still sore. But you're like marginally slow. So can I do it again?
Again goes back to what I said earlier. Yes, but change the way you load it. Go into isometrics.
Okay.
Or minimize the reps and make it plyometric.
Right.
Try not to. You can train the muscle, but change the loading pattern.
Loading pattern. Again, another question I'd probably want to ask you is sports massages.
Yeah.
And getting deep tissue massages.
Yeah.
Cupping. There's different methods of all of that. How important is it? And if so, how frequently should people kind of get that? I'm talking in the sense of guys who especially lifting, because that's most of
Yeah.
our audience are guys who go to the gym. How often should they kind of go for these deep tissue or sports massages? How important is it? And
It's
what's your take?
it's good, buddy, because what tends to happen is this, bro. Like typically in general, if you're someone who lifts a lot, like
Okay.
if you're like, again, if you're someone who does this, if you're an high-end athlete, if you're fitness competitor, whatever, because I see a lot of people from
Yeah.
all spectrums. If you're a general person who's just trying to stay fit, I would say once a month is enough.
Okay, once a month.
Okay, that's more than enough.
Yeah.
But if you're a competitive athlete, look, I'm not trying to create a business opportunity here. In fact, I only do sports massages once a week, and that's by this year I'm going to stop.
Yeah.
But if I had to put it, would be once or at least, so once every week. Once, so I would say even minimum, if you want to keep it down, twice a month.
Okay.
To prevent injury.
And on that, can we also touch on active recovery, like things that people now a lot of talk about: swimming, walking, going for walks on the days you don't really train. What kind of important role does that play?
It's now, for example, I love my walks in general, because I find you can think a lot as well.
For sure.
Reflective standpoint.
Morning walks are one of the best. Yeah.
Really good feeling afterwards. In general, bro, I think it's good to keep the body moving.
Okay.
Okay, because what tends to happen is the older you get, okay, I can say that now I'm going to be 33, but an old man.
Young. Still young, but yes.
But yeah, I always say that when I give myself, but essentially, bro, when you're working, and especially when you're constantly, when you with stress as you get older, especially once you pass 30, there's a decline in terms of maintaining muscle mass.
Right.
Your body starts to develop a thing called sarcopenia. It's a lot more prominent once you pass 55.
Okay.
But once you pass 30, to maintain that muscle mass is a lot harder.
Okay.
So essentially, it's always good from a psychological perspective. I think it's always good to keep your body moving.
Okay.
Just, it doesn't matter
how
keep moving. Okay. Also nutrition as well.
Yeah.
Both go hand in hand. You can't only look at one thing.
Okay.
So
for all the young guys, make the most of your youthful days.
Yeah. And I think even there's no such thing as after a certain age you need to stop doing things.
Okay.
That's bullshit.
Okay.
You need to keep moving. That's the difference between the Asian demographic. I mean, look, Sri Lanka has good thing, or like Asians in general have good value systems and stuff that we need to adhere to. But there are certain things we have to incorporate from in what the Western people tend to do.
Okay.
Because they are no champ. Like when they are a lot older, people are just doing their own thing by themselves.
Yeah.
They don't rely on their kids to come and help them out and stuff.
Okay.
Not that I'm not endorsing
Okay.
but you know what I mean.
Right. Absolutely love the information you're sharing.
Thank you. Thanks for the
I
opportunity.
mean, for all you guys who are watching, I would highly recommend Physio Roch service. I think he brings a lot of experience. That's what we love to say, experience as well as the knowledge. Before we wrap up the conversation, I just want to give you an opportunity to say any general advice as a physio for our audience. What do you have to offer? It could be anything, any general advice, and then we can wrap this conversation.
Okay. All right.
Some tips.
Just one specifically to when you say tips, can it be something just general regarding the
general
field
health.
even?
Yeah, anything.
Okay.
Literally anything. This is your opportunity to say anything you want.
Okay, I really need to get this message across because I feel that Sri Lanka needs this right now.
Okay.
I mean, at least the fact
Yeah.
that we need to distinguish what a physio is in general.
Sure.
So in Sri Lanka, I'm not going to throw out names. A physiotherapist is basically a medical professional who has studied 4 years, essentially. I'm not trying to say,
I understand.
the size of the penis sort of a scene. What I mean to say is, it's just that a lot of people have tarnished the name of what a physio is because same with Ayurveda. Because Ayurveda, if you look at an Ayurveda doctor, it's a 6-year degree. But people don't know that because of the whole stigma behind the whole spa scene
Yeah.
and all that stuff. Similarly, with physiotherapy, the people have just abused the name of physiotherapy. You need SLMC, Sri Lanka Medical
Okay.
Council licensing and whatnot, or a degree
Okay.
to say that you are a physiotherapist. So my point is, a lot of people call themselves physiotherapists or use the term physiotherapy. You need to do your research behind that,
Okay.
because physiotherapy, in the 4 years that we study, we cover 3 areas and we specialize in, and we do an internship in the hospital as well.
Yeah.
So one area is cardiorespiratory medicine, which I don't specialize in.
Yeah.
It's very you need to be at the hospital for that.
Mm.
So we treat conditions like bronchitis, asthma,
Yeah.
all that stuff. Anything that's impeding their patency in terms of breathing.
Okay.
Then the other area is neuro,
Okay.
which I also don't think I do on and off, but I don't do because it's very. You need to spend a lot more time with the patient for that. So that works on conditions which are affecting the central nervous system.
Okay.
People having cerebrovascular accidents, strokes,
Yeah.
strokes or Parkinson's disease, where we work on improving the activities of daily living.
Yeah.
Stuff like just going to the toilet and taking a dump. Like,
Mm.
for us it's okay because we don't have a problem.
Yeah.
But when we have
Yeah.
the issue, these are things people take for granted and they don't realize when
True.
they need assistance. So we help them do stuff by themselves in that sense, at least strengthen their muscles so that they can be independent
Got it.
in that field. And there's also musculoskeletal, which
Yeah.
I specialize in, orthopedic.
Okay.
So what I always say is, make sure, like a physiotherapist, whoever you go to, doesn't have to be me, can be anyone, when they call themselves physiotherapists, that they're actually a physiotherapist, not just
Yeah.
someone using the title where they've just gone for some 8-month massage
True.
course and they're calling themselves, because it's a huge area.
Understood. Yeah.
And
From what you talk,
just-
I can understand how
I
big
just
this
want to,
topic.
because I really
Yeah.
need to get this off my chest.
True.
And the other thing is, not all of us practice massage.
Yeah.
I do
Okay.
that as a side hustle when I don't have patients.
Okay.
But not all of us are massage therapists, and actually we're not massage therapists even.
Yeah.
We might be trained in certain techniques, soft tissue techniques, but we don't base our entire treatment on that.
Okay.
So that's the main thing.
All right. So
Thank you so much.
No worries. I mean, again, if you guys are always looking for someone, as I earlier said, I'll recommend you can find him on Instagram, as your handle would be
Roche Approach Physio.
Roche Approach Physio. We'll put it on the description as well. Thank you for joining. And if you have any direct questions, you can contact him through his Instagram, or consult him, get an appointment. I would highly recommend. And thank you for joining. And we will see you on the next podcast.